They tried to silence the doctor who saw the future. In the 1990s, a doctor began warning the healthcare system about something it did not want to hear. He had spent his life inside hospitals, intensive care units, emergency rooms, and pediatric wards. He had seen fear in the eyes of mothers. He had seen children suffer. He had seen patients sent from clinic to hospital, from surgery to laboratory, from one waiting room to another. Not always because they needed hospital care, but because the system had trained people to depend on doctors for every fear, every symptom, every doubt. And then he saw the danger coming. Antibiotics were beginning to fail. Hospitals, clinics, surgeries, and laboratories were no longer just places of healing. They were slowly becoming places where dangerous, resistant infections could spread. He warned them. He said the future would not be won by giving more antibiotics, building more hospitals, or creating more protocols. The future would depend on helping ordinary people understand their symptoms early, separate fear from danger, isolate when infection was possible, and seek the right help at the right time. But the healthcare profession did not listen. Some laughed, some dismissed him, some tried to silence him, because his message threatened the most powerful belief in modern medicine, that patients must remain dependent. Dependent on doctors, dependent on hospitals, dependent on chemicals, dependent on antibiotics, dependent on a system that was already beginning to crack. They thought he was the problem, but time has now exposed the truth. Hospital care is reaching a dangerous breaking point. Waiting lists are growing, doctors are exhausted, antibiotics are failing, infections are becoming harder to treat. Operations that were once routine may soon become dangerous. Cancer treatment, intensive care, childbirth, surgery, everything modern medicine depends on, is now threatened by antimicrobial resistance. This is not just another healthcare crisis. This is the biggest threat humanity has ever faced. Because when antibiotics fail, modern medicine does not slowly decline. It can come to an abrupt halt. And the painful truth is this: the doctor they tried to silence was not trying to destroy healthcare. He was trying to protect humanity from what healthcare refused to see. That doctor is Dr. Kadiyali Srivatsa, and the beacon of hope he created is Maya. Maya is not here to replace doctors. Maya is here to protect people before they become patients. Maya helps people understand their story, recognize danger, reduce fear, avoid unnecessary exposure, isolate when needed, and seek the right help before it is too late. Maya helps prevent. Maya helps protect. Maya helps people heal using the power already within them: awareness, calm thinking, early action, and human intelligence supported by AI. The old healthcare system waited for disease to arrive. Maya prepares humanity before danger enters the door. So here is the real lesson. They tried to silence the warning because they were too comfortable with the system they had built. But the most dangerous moment in medicine is not when hospitals are failing. It is when hospitals are still standing and people refuse to see that the foundation beneath them is collapsing. The post-antibiotic era has begun, and humanity now has two choices: remain dependent on a failing system, or learn to prevent, protect, and heal before it is too late. Maya is not just an AI. Maya is a warning. Maya is a shield. Maya is the beginning of a new era in healthcare. Because in the age of resistant infections, the safest patient is not the one who reaches hospital late. It is the one who learns early what to do, what to avoid, and when to ask for help. They tried to silence one doctor, but they cannot silence the truth forever.